our saliva is little bit acidic. After saliva, when the food mix and goes into the stomach makes 2.5 liter hydrochloric acid every day. Yeah, so around 700 ml each meal, and that is highly concentrated. And after that, when the food goes into the duodenum after the stomach, pancreas and liver is highly alkaline.
Yes.
So this is how the body metabolizes the food.
So I'm delighted and honored and blessed to be introducing you to one of my favorite therapists today. I am going to introduce you today to Dr. Sharma. He's been practicing yogic neurotherapy for 35 years, and he uses pressure points to get the body to heal itself. So Dr. Sharma, please tell us about yogic neurotherapy.
Yeah, so basically the yogic word is derived from the yoga postures. As we do the yoga postures, so normally we divert the blood supply towards certain parts of the body. Suppose if we sit in Vajrasana, like folding legs and sitting down, like sit in the Namaz position, then we cut down the blood supply in the legs and improve the circulation in the stomach area. Right. So this is how the principle of doing of yogic neurotherapy is taken from.
Right.
So suppose the ill person or the stiff person or the person having the knee problems cannot do the Vajrasana, and we want to perform the Vajrasana on him. So we apply the pressure on the thighs and on the legs. Second is the application and basic principle of this therapy is how body heals itself is the physiology. Right. Physiology means what medicines, what enzymes, what hormones, and what are the antibiotics and all body makes within the body.
Right.
So that's our gland systems, like the exocrine glands and endocrine glands, pancreas, gallbladder, liver, stomach. They are exocrine glands. So they make the enzymes. So all the enzymes body makes. Right. Even the alkaline, the sodium bicarbonate made by the pancreas. So right. This is how we target the particular enzymes and hormones through the particular glands.
Okay.
And this is why the yogic neurotherapy is very specifically have the pressure points.
Can you tell us in detail how it's different from yoga?
Yeah, like in general, if you suppose you do the head down position in yoga, the Shirshasana.
Right.
So the all blood supply goes into your head area is more.
Right.
So that all head is getting the extra blood supply. But especially if we want to stimulate the pituitary gland only in the brain, then we have the specific point on the hands. We press the blood supply there and pointed it to the pituitary gland.
So this is more directed flow of blood.
Directed. Yes, more directed, more specific, and more precise.
Can you show us some simple immunity points which will help us not get corona, basically?
Because there are 2 or 3 pathogens, virus, bacteria, and the microbes.
Okay.
So bacteria and microbes, body's macrophagus works on it. But especially on the viruses, each virus and each antidote has to be made for the particular virus. The polio virus, we have the immunity dose when we are young, when we are very young. So we develop the immunity for the polio virus. So the name of the virus is SARS-CoV-2.
Right.
And the disease is COVID-19.
Yes.
So when this virus goes inside our body, so our immune system, with the help of T helper cell and T killer cells, makes antidote for this virus. And that antidote kills the viruses. So then you are immune to this virus.
Right.
So how to improve that immunity?
Right.
So that is basically the 3 glands we are using for that. This therapy is totally based on the glands and the own body's immune system, own body's digestive enzymes, own body's hormones.
Right, right.
So we choose the 3 glands, thymus, tonsils, and parotid glands.
Right.
Thymus glands is the main gland for the virus coding and decoding.
Okay.
Thymus gland makes the antidote and T helper cell and T killer cells.
Okay.
That's why giving the name T-cal. T means thymus, matured by the thymus. Very simply, I will teach you 3 massages today. This is our collarbone. And below the collarbone, this is the 2 lobes of the thymus gland. So
Right.
left side is little bit smaller and right side is a little bit bigger.
So the left lobe is smaller. Okay.
Little bit smaller.
Fine.
And right is little bit more bigger.
Okay.
So what we use this part of the palm
Right.
below the thumb and put it in middle of the chest and go toward the collarbone.
Yeah.
We make a V, like a V shape here.
Right.
So do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Right.
Then we use the left hand and same on the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 2 rounds.
Okay.
12, 12 and 12, 12. And not very hard, but fast massage. We are rushing the blood in that area.
Okay.
In the thymus gland.
Okay. Okay.
Second is our tonsils are below the jawline. See, these are the tonsil areas.
Right here. Yeah.
Then, yeah, we use this part again because this is the cushiony part.
So you got your right hand out. No, you got your left hand out first.
Yeah, left hand first.
Yeah.
So we'll take the left side.
Okay.
And just below here, upward 12 times.
1, 2, 3.
Like this 12 times. Upward. Same on other side. So we are massaging on the tonsils.
Okay.
Rushing the blood in that area. And then third one is the parotid glands are the just this part of the face. So we will just go down like this. This is downward 12 times. Yeah?
Yeah. Yeah.
And then other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Yeah.
So what is the significance of these massages is we are activating our thymus gland
to
make the more T helper cells and killer cells.
Okay.
This will make your immune system robust, alert condition.
Okay.
If any virus comes into your body, immediately body starts making their antigen and antidotes.
So now, Dr. Sharma, I have 2 questions for you to follow with this. One is, what conditions can people not do it in? So like heart patients, blood pressure patients, please tell us.
Everybody can do this. And how to do this and how frequently to do this, this is I'm just explaining.
Okay, fine.
So first thing, this thymus gland, using the thymus gland and massaging the thymus gland should not be done by the pregnant ladies. Other 2 massages they can do. Second thing, those who have the organ transplant, they should not do more than twice a week. Normal people, every day they can do once a day. And if you are staying with somebody who has the coronavirus, or you are a health worker dealing with the coronavirus patients, then you should do twice a day. If you come to know that you are infected, then you should do 4 times a day. Why these massages are very important? Because whenever the coronavirus comes into the body, it is coming through our face area, like from eyes, nose and mouth. Because these 3 areas has the opening into the body and have some mucus membranes. Right. So on that mucous membrane, when this virus gets stuck and traveling toward the lung, we have to stop it just before the throat. Okay. If it goes down into the lungs, then it flares up very quickly, multiplies very quickly. So we are God gifted, or the nature made our body is so. The tonsils are situated in your throat area. Your saliva has the 2 antibiotics, penicillin and streptomycin. Right. No, I don't think anybody knows this, that our saliva has the penicillin and streptomycin. Naturally, we produce antibiotic in our saliva. Right. Okay. So anything is staying there, virus or bacteria, first line of defense is the parotid glands and the tonsils. Yeah, so if the virus suppose reaches into the lungs, where they land onto the ACE receptor 2, the ACE is angiotensin converting enzymes, if it lands there and the spike of the virus stick onto this receptor, then it flares up very quickly and it's multiply it very quickly. Because virus cannot multiply on its own. It needs some living cells to multiply itself. And also, older people can do this, right? Once a day. Everybody, even the 6-month-old child or 100-year-old. Yes. I know you've also been working with some really small newborn babies. Yes. So it's okay to do this on a 1 or 2. Very good to do, because their thymus gland is the biggest. Up till the 5 year of the age, our thymus gland is very, very active to take all the codings of the viruses and bacteria.
So
Yeah.
in the East, people like, thought leaders, as you can call them, like Sadhguru and others are saying, make your body and mind stronger. In the West, people like Oprah Winfrey are saying the same thing, that make yourself physically and emotionally stronger to cope with anything. Can you tell us how, using your therapy, we can do those two things?
See, physically fitness means your muscles are strong, your bones are strong. So physically strong is good, emotionally strong is good, but immune and our internal medicine system should be the most important. Good body, less stress, and well robust immune system will survive. So the fittest will survive. So all three aspects we have to survive. So fit body we can do with the exercises, with good foods. Good food means the balanced diet, not some high protein diets only, some starvations and the losing quickly weight. That's not very good. So balanced diet, balanced lifestyle. Stress makes the immune system low. So this is the most important thing I want to share with you. Whenever we stress, our cortisol level goes up. Whenever the cortisol level goes up, immune system goes down. So this is the immune system and anti-inflammatory system works in a balance. With the balance, if the both side weight is same, the balance will be in equal. If your stress is down, very stressed, your cortisol level will go up. So the immune system will go down. Once a cortisol level comes down, stress level comes down, your immune system goes up. So it goes like this. So whenever you are stressed, drink water and do deep breathings, pranayamas.
Okay, I'm drinking my water now.
Yeah. So that's the most important. So cool down your system. Whenever your blood pressures are up, the cortisol level is up, your blood supply vessels are more strained and thicker. Yeah. So what happens when the blood supply vessels are thicker? Whenever our blood supply is less in the organs, then the coronavirus patients especially, we need the more circulation in the blood at the time when the body is attacked by the coronavirus. Then we need the blood supply to open up. So that's why we need to do certain exercises, pranayams at that moment to increase the more oxygen.
And in terms of making ourselves fitter in some way, I know you're very focused on the digestive system. You always say if our digestion works properly, our body gets fitter over time. So
I will show the two massages. One is for the digestive system, for the absorption. Because that's the most important. The absorption is the most important. Whatever we eat, it should get absorbed. If it is not absorbed, then we are not getting any energy from the food, whatever we are eating. Absorption should be very good. And for the absorption, I'll show you one pressure point on the thighs. We are putting the pressure on the thighs. If you can see this pressure point.
Yes. Can you lower it slightly? Yeah, perfect. Yeah, yes.
Above the knee, and your family member will put her or his hand first up the thigh for 8 seconds. 1, 1, 2, 2, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. Move on to the second part, at the thigh. 8 seconds again. After finishing 8 seconds, move on to the third part. This is above the knee, not on the knee. Just 2 or 3 inches above the knee. 8 seconds again. This is one round completed. Again start from up. So mostly it's 4 rounds is given in your chart. It's very simple. You just lie down and put a pillow under the thigh and start pressing from up. So when we press, we are stopping the blood supply there for few seconds, 6 to 8 seconds, and pumping the blood. So in 3 points when we give that pressure, around 4 rounds, so we are improving our circulation in the stomach area. So then your digestion goes better and your absorption gets better.
Okay, great. So your first 2 points were near the top of the thighs.
First top of the thigh, then middle of the thigh, and then
the third point was above the knees, correct?
Above the knee. And now the second part basically is now the stress part. Suppose somebody is stressed.
Right.
What happens when we are stressed? Not only the brain, our stomach goes inflamed.
Gets inflamed. Okay.
It
Right.
gets inflamed.
Yes.
And when the stomach is inflamed, then what happens? Our intestine, which makes the serotonin, especially for the depression patients, for the anxiety patients, deprive of the serotonin makes you more anxious or
Right.
more in depression.
So is that what's happening now, you think, when people are, it's their serotonin levels
Yes.
have come down because
Yeah.
anxiety levels, depression levels have gone up all over the world?
Yeah. So this is the main concern nowadays. Mostly people are in anxiety or stress or depressive level.
Okay. Okay.
So they need the more serotonin in the body and
Right.
epinephrine from the adrenal gland. These are the two things body needs more nowadays.
Okay.
So serotonin we can stimulate
Mm-hmm.
through our intestine. So I'm going to show one point for the intestine to improve the serotonin in the body.
Okay.
If you are very anxious, anxiety level is high, stress level is high, then what you should do, below the knees, on both the legs together. This is again alternatively you do the 3 steps. First up, middle and down, up, middle and down on both the legs together, just below the knee first. Move on to the second point. 8 seconds, up 8 seconds, move on to the third point. Like this, alternatively you will do. Mostly it's the 4 rounds.
So these points are below the knees?
Yes.
3 points, 4 times?
4 rounds.
4 rounds, okay.
Yeah. So this is basically for our small intestines.
Okay.
And this helps to generate the serotonin in our body.
They have chronic pain in their lower back. What would you recommend?
Lower back. See, these are the other specifically pains are very different.
Okay.
If young people have these kind of pain while doing exercise or something, muscular pains, nerve pains, if the disc space is reduced, if they have the spondylosis, if they have the spondylitis, if they have the spondylolisthesis, they are very different pains.
There's different pains.
There's no one point like in other therapies that this point is for lower back, this point is for cervical pain. It's not like in this therapy. Because we go on to the causes of that problem.
Right.
Yeah. So suppose somebody has the pain whose age is around 65, 70.
Right.
So they maybe have the degeneration and the stenosis of the bone. So the treatment is very different. If young people come around 20 age or 30-year-old while sitting on the table job and doing the wrong exercises in the gym and comes with the back pain, maybe the muscular or the stiffness of the muscular.
If you have weak lungs and breathing problems, what would you recommend for that?
For the breathing problems.
And weak lungs, yeah.
Weak lungs.
Yeah,
weak lungs, the pranayama is the best. So anybody who has the, like some people have the lungs fibrosis.
Right.
Some people have the lungs ILD, interstitial lung disease.
Right.
So those kind of very chronic patients are different.
Yeah.
To them, I have to see them properly and then diagnose.
Okay.
But general weak lungs, then you can do this thymus massage and pranayams.
Okay.
Yeah.
Okay, fine.
I would suggest that any inflammatory disease, people should not eat too much of sour things.
Okay.
Any inflammatory disease.
So any kind of pain?
Any kind of aches and pains and inflammations in the body.
Okay.
They should reduce the sour things in their diet.
What do you do for immunocompromised patients?
The immunocompromised patients are 2 types of patients.
Right.
Suppose somebody has the rheumatoid arthritis or multiple sclerosis.
Right.
So they must be on the immune suppressant medicines. So that is the immune suppressant medicines are to suppress their immune system, so it should not attack on their body.
If someone has reflux or heartburn, what would you recommend?
Heartburn.
Yeah, and reflux, what would you recommend?
Yeah. Heartburn and reflux is because of the esophagititis. The food pipe is called the esophagus. If it is inflamed,
right.
So you have our food pipe will have the one-way traffic rule.
Right.
The food should go down, should not come up.
Right.
Suppose if we do the head down, The
Yeah.
food doesn't come out of our food pipe. But
Right.
if it is inflamed, so the food comes up with the gastric.
Yes. Yes.
So the point I showed on the both the thighs together
Mm-hmm.
will help in these kind of patients. On both the thighs together, when we do the 3 rounds,
Yeah.
three
That,
pressure points, 4 rounds. So that
fantastic.
gives the digestion and it controls your inflammation as well.
So those are for the upper thigh, the 3
Upper
points
thigh.
of the upper thigh, not on the leg.
Upper thigh, middle thigh, and lower thigh.
Is there a particular type of pranayam that you recommend?
See, pranayams are all good. Only the Kapalbhati should not be done with the patient if they have the high blood pressure and heart condition.
Okay.
Other all pranayams are very good. One pranayam is especially for the people, just now you asked the question, the heartburn and the acid reflux, is the Sitali pranayam. Mostly people, I don't think they know the Sitali pranayam.
Sitali, yes, then. Yeah.
Sitali pranayam is very simple. Close your teeth and just suck the air through your mouth.
So it goes in cold. Yeah.
Yes. So it will be like a peppermint effect in your, like a cool effect in your throat area.
Okay.
That you can do 5 or 10 times Sitali pranayam.
Lemons and limes, are they okay? And are they considered alkaline and anti-inflammatory?
Alkaline and acid only can be tested with the litmus paper. With the litmus paper, if the lemon or lime is showing onto the acidic side, then it's acidic. I don't believe in this therapy that if you take the acid and goes into the body and turn into the alkaline, doesn't happen like this. Our body is like a chemical factory. The measurement of the alkaline and acid is determined with the pH factor. So water pH factor is from 7.36 to 7.44. Below that is acidic, above that is alkaline.
Okay.
So I will explain you. Our saliva is little bit acidic. After saliva, when the food mix and goes into the stomach makes 2.5 liter hydrochloric acid every day. Yeah, so around 700 ml each meal, and that is highly concentrated acid, very high acid. And after that, when the food goes into the duodenum, after the stomach, pancreas and liver is highly alkaline.
Yes.
So this is how the body metabolize the food. When you chew food, saliva mix in it, slightly acidic. First stage of protein digestion happens in the acidic environment.
So when people are talking
Second stage of digestion in the stomach happens in the highly acidic environment.
acidic, yes.
If you eat some alkaline, too much of alkaline, antacids, you are neutralizing your stomach acid. So how you will digest the proteins?
So Dr. Sharma, when people talk about turning the body alkaline, are they talking about the liver and pancreas here in particular?
If you turn all your body alkaline, you will be having too much of convulsions and fits and too much of the no protein digestion, muscular weakness, everything if you turn your whole body alkaline. So body has the different areas, different pH factors, slightly acidic in the stomach, mouth, highly acidic in the stomach. After that, highly alkaline in the duodenum, and then intestine slightly acidic.
Thank you so much for your time, Dr. Sharma. That was a real pleasure having you here.
Thank you.
Thank you for listening to this chat. If you enjoyed it, please subscribe to this page. Please subscribe to our podcast on Apple and Spotify, Wellness Curated, and follow us on Instagram, Wellness Curated, the number 1. Thank you.